What is 340B? To find out, let's go back to the early 1990s. Money was tight, as it always is, and it was a difficult time for America's safety net providers, those providers treating large numbers of poor and uninsured patients. So as part of the Bipartisan Veterans Healthcare Act of 1992, Congress created the 340B drug pricing program. The 340B program allows qualifying safety net providers and certain qualifying hospitals to buy prescription drugs at discounted prices from drug makers. As Congress stated, the goal of the program was to enable these entities to stretch scarce federal resources as far as possible, reaching more eligible patients and providing more comprehensive services. And since 1992, that's just what 340B has done. Let's explore how 340B actually works. Here is a small clinic in Ohio that participates in the 340B program, and two of their patients, Bob and Tina. Now let's say a 1-month supply of a diabetes drug costs the clinic $1,000 from a drug maker. Tina has private insurance, which pays the clinic $1,100 for her medication. Now, Clinic A has $100 in income, but with 340B, the clinic can buy that same drug from the same drug maker at a special lower price of $600. With 340B, the clinic still gets paid the $1,100 by Tina's insurance, but the sale now generates $500 in income, which the clinic must use towards its expenses. Now, along comes Bob, another patient at the clinic. Bob doesn't have insurance, but he needs medication too. Fortunately for Bob, the clinic now has that $500 in 340B savings to help pay for his treatment, and that $500 hasn't cost taxpayers anything. Without 340B savings, many clinics and organizations would have to find new money to stay open, most likely from taxpayer dollars. Either that or the clinic might be forced to send away patients like Bob, and those patients go untreated. Or worst of all, the clinic could close down altogether. But thankfully, clinics and their patients thrive with 340B because it allows clinics to offer better means of treating and keeping patients in care. The 340B program is already well regulated by the Federal Health Resources and Services Administration, which established rules that manufacturers and providers must follow to participate in 340B. Congress also keeps a very close eye, and 340B safety net providers and hospitals are subject to oversight, monitoring, and regular audits. Smaller safety net providers like Ryan White clinics who treat patients living with HIV/AIDS are concerned because the mechanics of 340B are often questioned or reevaluated by lawmakers and challenged by drug makers that would rather sell their products at a higher price. The truth is, this small program that does a world of good only accounts for 1.3% of all drug purchases in the U.S. We want to protect the vital assistance 340B gives to Ryan White clinics and all safety net providers. 340B has been working as intended for safety net providers and their patients for over 25 years, and that's why we'd like Congress and elected officials to simply let it be. To get involved and find out how to protect 340B, visit let340b.org.